Good afternoon, everyone. Happy Veterans Day today. I do want to just say thank you to the veterans who have been in the service or who are currently in the service, fighting for the freedoms of our country. We know that that's a sacrifice that you and your families have made and are making, and just want to say how much we appreciate that. Earlier today, the History Museum and Soldiers Memorial did a virtual parade. You know, everything's virtual. You can still see that. It's clips from previous parades, and it's videos from various folks to try to honor our veterans the best way we know how during COVID. So we'll post a link to that in the event you want to go on and watch that. I encourage you to do so. It's touching and worth a few minutes of your time. So that's Veterans Day. You know, the city's not working today, but we wanted to be sure that we were here to talk with you as normally scheduled on Monday and Wednesday, sometimes Monday, Wednesday, and Friday. So I want to talk with you a little bit about the numbers. You likely know that yesterday was the highest number of cases in the United States, and over 140,000 cases in one day reported. In the city of St. Louis, we reported 177 cases yesterday. St. Louis County reported 577. St. Charles reported 381. The state of Missouri reported almost 4,500 cases. So our region, as well as our state, is having the same sort of surge that is happening all over the country. Let me give you a couple of average numbers. We began looking at this in the state of Missouri, and this is for the last 7 days. The average number of new cases for the last 7 days in the state of Missouri was 65 per day. 65 per day per 100,000. That's important. 65 per 100,000 people. In the city of St. Louis, it was 40 per 100,000 people. St. Louis County, it was 61. St. Charles, it was 73 per 100,000 people. Jefferson was 74 per 100,000 people. So as you can see, everyone's numbers are up. The city's numbers are up also, but not up as much. They're significantly lower in the city than they are in the other counties per 100,000 population. Don't take that to mean they're good. They're not. They're bad in the city also, but not as bad as they are in St. Louis County, and especially in the surrounding counties, Jefferson, Franklin, St. Charles. So that's that sobering news. The number of people in the hospital, and you know these hospital numbers lag 2 days behind. 657 people in the hospital with COVID, confirmed COVID positive, another 135 suspected, for a total of 792. That's almost 800 people in the hospital in our 4 hospital systems in this region. The highest we had had before that was back on, 757 was the number, and it was very early on, probably in May or June. I don't have the date in front of me right this second, but quite a while ago. Number of people in the ICU, 134, plus 16 suspected, so a total of 150, and a total of 84 people on ventilators. There's almost no good news in any of these numbers, except that the growth in the number of people on ventilators has not mirrored the growth in the number of people in hospitals. So patients admitted yesterday, 2 days behind, 114, and 99 people discharged. So an increase of 14 between admissions and discharges. Um, you may have seen that we posted yesterday a map of the city of St. Louis and where the most cases are. I'm going to show this to you, but you can see it on our Facebook or Twitter. This is probably hard to see, but what it demonstrates, the yellow on here, can you see the yellow? Let's see. Are we having a problem here? I see something popped up. What do we got going on there?
There's nothing.
Okay, that video. All right, sorry about that. Something popped up on my screen, but the yellow is the highest number of cases. Now, of course, everyone wants to know, well, why? Why do we have such a high number of cases in the 16th ward, the 23rd ward, the 14th ward, 16 and 14 highest? Another pocket in the central west end, a little bit east of Kings Highway, roughly Kings Highway and Lindell, Kings Highway and Euclid, and then here in downtown along sort of the Wash Ave corridor. There are some reasons for that. Of course, those are densely populated areas, but and so that has something to do with it. But also just, you know, through our contact tracing efforts, what Dr. Eccles and his team have concluded is that this spread is really happening in neighborhoods, between neighbors, in close families. It's happening in social gatherings primarily. And so, you know, we, the government, we certainly cannot control that, but we are speaking with all of you to try to get you to curtail your social activities, and that, I know that's hard. Curtail your social activities. Keep your group small. And we had a call with aldermen yesterday. We have one every Tuesday with aldermen. And I had been using the term, keep your pod small. And somebody said, I don't know what a pod is. So let me try to explain that. It's not very tough. Basically, if you can, stay with just the people in your household. If not, just your household and one other, so that you have a consistent group of 6, 8, 10 people that you see. And therefore, if one of you does turn up to be positive, then you will know who you've been around, and those people will need to quarantine at that point. So it's nothing complex. It's about keeping the group of people that you're with small. We are recommending no more than 10 people in that group, keeping your gatherings small. Because when you do that, it's certainly much easier if one of you does turn up positive for you to quarantine. So those are our COVID numbers for today. I expect that, you know, there's a move afoot to sort of promote this idea of safer at home. Now, what does that mean? Really means exactly what it says. Keep your group small, stay home when you can. We know you have to go to work. We know you can't stay home all the time. But really put some thought into this and consider whether you really need to venture out. That's the advice at this point in time. We are working, the City of St. Louis is working with the Pandemic Task Force. We had a call yesterday afternoon. All the heads of all the hospitals, all the county executives in the region, all the public health officials, our federally qualified health centers, all on that call, really trying to come to some terms with what measures can we put into place, and is there anything that we're willing to put into place region-wide. At this point, it looks like that is probably very unlikely. So we will continue in the City of St. Louis with our mask mandate, as we have since about the 1st of July, and it has helped. You can tell that by looking at our numbers. You can tell it even by looking at St. Louis County numbers. People in the City of St. Louis are by and large following the mask mandate. Always do more, always do a little better, but by and large they are following the mask mandate. It's not just about mask mandate, it's about mask mandate and staying 6 feet apart. Both very, very important. And of course, washing your hands, you all know that. All right, that's That's all I have for COVID today, but I'm thinking there might be some questions. I don't know if we have very many people logged on today since it's a holiday for a lot of folks.
About 250.
But, well, good. So a lot of you are watching today. You know, banks are closed, but there are a whole lot of people that are working today. Our police department, our fire department, all of our first responders, of course, are working today. And thank you for that. We know that you have to do that whether it's a holiday or whether it isn't. Our hospital workers are working today. Airports open today. Most people are working, is what I would say. So thank you to those of you that are working today. We appreciate your keeping the wheels rolling.
Okay, a couple of questions, Mayor. You said we're on an unsustainable track in terms of new cases and hospitalizations. Can you speak to what sort of additional mitigation strategies or possible restrictions are even under consideration or on the table?
So everything's on the table. And as I mentioned a minute ago, we're really trying to work together, St. Louis City, St. Louis County, surrounding counties, and the healthcare systems to put some measures in place that, one, we think people will follow to a large extent, trying to give some good advice because we know that nobody wants to get sick. So everything is on the table. I think we all need to stay home more. Let me say it in those words.
Do you still have confidence in the use of masks? This comes from Andy. We've had the mask mandate since July, but cases are setting records, hospitalizations are setting records. Do you still believe that they work, and are they effective?
You know, Andy, yes, they work. We know they work because places that don't have mask mandates have a higher number of cases. So we believe that it is one of the mitigating strategies that is effective. It's not the only thing, but it, combined with social distancing, combined with keeping your groups small, help to keep the numbers down and to keep more people from getting ill.
You sort of mentioned this, Mayor. We do have a couple of questions about what our data and contact tracing is showing as the specific point of transmission in terms of where it is happening. Has the health department been able to identify specific gatherings, restaurants, churches, schools, youth sports that is the source of our community spread?
There is not one answer to that. What the health department knows is that it is primarily in small gatherings, in neighborhood gatherings. Nursing homes, congregate care facilities, through our health department, working with them on infection control, their numbers are way down from where they were early on in this pandemic. Schools, I spoke with Kelvin Adams, Dr. Adams, this morning, and their elementary school kids are in class, and they're continuing to watch the numbers, but because of their good infection control procedures, things are going pretty well there. Hair salons, somebody mentioned to me the other day there was a nail salon, but these are one-offs. This is not a pervasive thing. So when you think about gyms, though, and personal services, hair salons, nail salons, all of those places, those are difficult places, but right now it doesn't look like they necessarily are the nexus. We know bars and restaurants, there's some spread there, but it's everywhere. It's pervasive in the community.
So a couple of folks, since you have brought it up, Mayor, have asked about schools. Nikki has asked, do you anticipate a reversal in the direction of the reopening of schools, or do you anticipate them going back to all virtual?
So we don't know the answer to that yet. Each school district gets to decide that, but they do it in conversations with the health department. Dr. Eccles, I know, speaks regularly to Dr. Adams and Will Pinkney, Dr. Pinkney, who's in my office, Director of Children, Youth, and Families. And what you see is that some schools, because they have had an outbreak, and I'm talking about in the region now, not in the city of St. Louis, they have gone back to virtual. So everybody is trying to work through this as best as possible. Everybody also believes that if possible, kids are better off in the classroom. But it's not just about the kids, it's also about teachers and it's about staff. So All of that has to be taken into consideration. So there's no change to announce on that at this point.
Question from Jasmine, Mayor. Do you anticipate additional restrictions that are under consideration having continued impact or further impact on businesses in the city?
Jasmine, that is one of the toughest issues when you do put more restrictions in place. We know that we impact businesses. Our hospitality industry has just been devastated. Hotels are devastated. Restaurants are devastated. Our convention center hasn't had a convention in 8 months. So we know that that devastates those businesses, and when it devastates a business, it devastates people. And one of the really big weights on me is to say that right now there is no federal help for people. There is no federal unemployment. There is no additional subsidies for businesses. We're doing the best we can here in St. Louis. You know that we have a new program that'll roll out on Monday for additional $5,000 grants. And that's helpful. That's what we can do. That's what we have the funding for. But when we make these decisions about staying at home or safer at home or closing some sectors, we know, I know, and you know that it affects employees. And that is, employees need to be able to provide for themselves, for their families, and without a job, it's very, very tough.
Pritz and some other folks have asked about current guidance from the city about folks who do go to work in the business community. What is the current recommendation for people? Is it to work at home if you possibly can?
Work from home if you can. But most people frankly can't work from home. Most jobs you cannot do from home. You think about all the people that you see out working. You can't check out groceries from home. You can't be a policeman from home. You can't, be an EMS driver from home. So most people cannot work from home. And so if you cannot work from home, then obviously more precautions having to do with mask wearing, social distancing, and making sure that you're following all those precautions. Not just while you're at work, though. What we've found is that some folks who have turned up positive, they haven't gotten it from work. They've gotten it from their social activities when they're not at work. So, if you're going to work from home, you got to curtail those other activities as well.
Speaking of federal aid, Mayor, Dean is watching and had a question about a story in the paper about how about $1 billion in federal virus relief money has gone unspent in the city, or in the state of Missouri, rather.
Mm-hmm.
Your thoughts on that, and shouldn't that money, he says, be going toward helping people fight COVID-19?
Absolutely. Dean, was that Dean,
Mm-hmm.
did you say? Absolutely, Dean. So the city of St. Louis received $35 million in CARES Act funding. We've committed all of it. Most of it's spent, but it's spent and committed, in the process of being spent. As you might know, we committed $7.4 million to rental and mortgage assistance. It's being spent every day. We have about close to 1,500 units that have been paid for directly to the landlord. So absolutely, that money that is not spent and has not been allocated at the state level should absolutely be put to work very, very quickly, because at least today, those funds have to be spent by December 31st. Now, we're hoping, and expecting is too strong of a term, that there may be an extension of that December 31st timeframe to spend the funds. But there's no guarantee of that, so we're working very hard day after day to make sure that we spend those funds directly to help people and businesses.
Do you have a anticipation of how much leeway people might get, or how much time businesses might get before additional measures or implementations are put into place?
I think it's like, if there are additional measures, and to the extent that they affect businesses, I think it'll be a few days. It won't be the next day. We want to give people if we have to make a change, we want to give people as much advance notice as possible. But frankly, we're in a situation where you don't want to make I want to announce a change today. It needs to be effective fairly soon, so.
So Jeff and some others have asked about your South St. Louis map, Mayor.
Mhm.
Is it happening because of the dense population, because we're doing
Yes.
more testing in South St. Louis, or is it a personal behavior thing?
Dense population and personal behavior. We do have additional testing in South St. Louis that we put into place about 2 weeks ago. But frankly, up until then, the majority of our testing had been north or central. And because early on, we were not seeing that many cases south. But now we have a testing at 3930 South Broadway. That's an Affinia site. We've had that in place for months, 3 months maybe. But on Tuesdays and Wednesdays now, so today's Wednesday, Tuesdays and Wednesdays, there's a drive-through, and that's in connection with the State Department of Health, the National Guard, Affinia, and the City of St. Louis. So that is happening. So there is more testing, but primarily it's behavior.
A few folks have asked about an update on how many people are leaving the hospital. There's a lot of conversation about who goes in and how many are going in. But what are we learning about who's leaving and how many people are leaving the hospital?
So we report on that daily. Yesterday, 2 days ago, so probably Monday, 99 people were discharged. The day before, 50, 61, 100, 90. So we are reporting the admissions every day, and that's important, but certainly it's also important to know that many people do leave the hospital. And you know, if you've been in the hospital lately, or someone that you know has been, they don't keep you any longer than they have to. And the hospital's really not a place you want to be if you can help it. So, yes, there are many people being discharged from the hospital.
This might be our last new question of the day, Mayor. This is also a Jeff. A lot of new cases in the exurbs and rural areas of the bi-state region, St. Charles, Franklin, Jefferson counties. Are you and Dr. Page in conversation with those counties, and how are those conversations going about COVID-19?
We absolutely are in conversations with those counties and the health departments in those counties. I mentioned earlier the Pandemic Task Force, which we are a part of, has a call every Tuesday. We had an hour-and-a-half call yesterday. Those counties because we have no statewide direction in terms of mask mandates, each county gets to make their own decision. You know, I wish we had a statewide mask mandate, and I wish all of those counties, that everyone there would wear a mask as well. You know, the higher mask compliance and social distancing compliance that we can get, the lower our numbers will be.
All right, I have 2 more questions.
Okay.
A lot of conversation this week about Pfizer's vaccine. What conversations are happening in the city of St. Louis to make sure that we're prepared to receive the vaccine and get it out into the community?
So thank you for that question. Yes, there's some encouraging news this week. Monday, I think it was, on Pfizer's vaccine. Some encouraging news on some other vaccines that are also in the works. And, you know, it will be distributed primarily through the federal channels. We are in constant conversation with those federal channels. Dr. Eccles, the county executive's individual who heads up their health department, Spring Schmidt, in order to make sure that as that vaccine becomes available, it gets rolled out, who it gets rolled out to first, probably healthcare workers, first responders, the most vulnerable people first, older, underlying health conditions. So yes, that we're in a lot of conversation about that, but that's also most likely several months away. We're only in November, and for any large rollout of that, we're looking at several, 3, 4, 5, 6 months away. That's why we have to continue to do these mitigating factors.
I think this is our last new question of the day. Mayor, you might have touched on this, but Chuck had a question about nursing homes, congregate care facilities, hospice, long-term care facilities. what is happening in terms of cases there? Are they a significant driver of our increases?
Chuck, they are not a significant driver of our increases. That's one of the things that our health department has worked very hard on with the owners and management of those nursing homes and congregate care facilities. They have good infection controls in place, and so we continue to work very closely with them. That's not what's driving our numbers at this point. It was early on, 6 months ago it was, but it is not today.
That's it for new questions today, Mayor.
Thank you all. Appreciate you joining in today on this Veterans Day. Let's not forget, thank a veteran, and appreciate you all being here today. Thank you.